right, good morning Queensland. Hope everyone's having a lovely day. So we have some good news today. We have 8 new cases. 1 is detected in hotel quarantine and 7 are in home quarantine, which is fantastic and all linked with that Indooroopilly cluster. So Dr. Young will go through that. But one interesting aspect of that is one of the locally acquired was linked to that Japanese class that they had at St Aidan's, which was detected in about day 12. So once again, it's been very important for people to stay home in home quarantine, and I thank everybody who has been doing that. I know quite a few people will come out of that lockdown tonight, and of course we've seen Indooroopilly State High School open again today as well. So thank you to everyone who's been doing a terrific job. I know it's been an inconvenience to many families out there, but you have helped to keep Queensland safe, so thank you. So we have 158 active cases. We've had 35,503 tests yesterday, so that was good. And out of those tests, 4,266 were in Cairns. And please, Queensland, remember, if you have any symptoms, please go and get a test. Absolutely critical. 15,811 vaccines were administered by Queensland Health yesterday. I'm advised at our vaccination centre around 1,500 were done, and we're planning to do 3,000 on Saturday and 3,000 on Sunday. So that's great. I remember I bumped into Billy at South Bank yesterday. He was walking his baby daughter around South Bank, and his wife had gone over to get the vaccine over at the mass vaccination centre at the exhibition centre, so that's fantastic. All right, so Dr. Young will go into a bit more detail about that. Of course, we're still monitoring the situation in New South Wales. Of course, this will be discussed at National Cabinet today. I think from our point of view, from Queensland's point of view, we are very concerned, as I said yesterday, about how the clusters are continuing to expand. I think we would need to hear very clearly from New South Wales what their clear plan is for containment. The last thing we want to see is this virus spread north, the virus spread south and spread across the nation. So it's absolutely imperative that, that New South Wales contains this virus. We wish them all the very best, but of course we still remain concerned, and we're looking forward to getting that update from New South Wales at National Cabinet later on this afternoon. So I'll hand over to Dr. Young. Thank you.
Thank you, Premier. Yes, so excellent news. And the most important news is that those families are all gradually coming out of quarantine. And I just want to thank them. By the work they've done, they have actually saved lives. I can't say how many lives, but there is no doubt in my mind they have saved lives by what they've done. So we're now at 137 cases related to that Indooroopilly cluster. And one of those cases today is linked to St Aidan's Girls' School. So that was very important that all of those people were in quarantine. Thank you very much, the St Aidan's Anglican Girls' School community. And then the others were related to Ironside and to Brisbane Boys Grammar School, and there were test positives on day 10, 11 and 12. So we're still seeing those cases come through. But it's wonderful to see that all of those people can now come out and go about their normal lives. Those cases related to the 137 cases, unfortunately, of course, those families are going to have to continue to quarantine until it's 14 days since anyone in that household has had contact with a positive case. So I'm really sorry for those families. They're going to have to continue to persevere, but very, very grateful to them, because having had those 137 cases in quarantine during their infectious period meant we could control this outbreak and stop it spreading to the broader community. So it's been critical. And then no cases in Cairns, despite another day of enormous amounts of testing. So thank you very much to all those people in Cairns who have continued to keep coming forward. Please keep doing that, because we know that you can see cases continue to pop up. So it's really important. Just come forward and get tested if you have any symptoms at all. And then throughout the state, please, we don't know when a case will come up into our state from New South Wales. We saw how rapidly they've had an outbreak develop in the ACT. From one case, they've already got more cases. They've had a lot of positive notifications in their sewerage. So that's why we had to rapidly put in place those restrictions here for people who've been in the ACT. So anyone who's been in the ACT since the 9th of August, I'm asking that you immediately quarantine yourselves at home for 14 days from when you left the ACT. And as of 1 a.m. on Saturday, anyone who arrives will be required to go into hotel quarantine because there is a significant risk. The ACT was one of the last places in our country that people from Queensland could easily travel to and from. If you think we've had restrictions on other states and other states have had restrictions on us. So really, I think there have been a lot of travellers going to the ACT. So I'd ask anyone who's been to the ACT in the last 2 weeks to just check our website for any exposure venues in the ACT and contact us if you've been to those exposure venues. And anyone who's been there since the 9th of August, please, it's really, really important that you stay home and quarantine. That's critical. And the slightest sign of a symptom, that you get tested and do a day 12 test before you exit. And if you could do one as soon as possible, that would be really good.
So thank you to all of the Queenslanders coming out and getting tested and also vaccinated. We're seeing an uptake not just at our Queensland health clinics but also at GPs, and now that we have more pharmacies opening up, we are seeing more opportunity for people to come forward and get vaccinated. So if you're not sure what's available in your local community, please jump online. You can check through the eligibility checker and also putting in your postcode and find out not just where your GPs are, but also where your community pharmacies are and where the Queensland health clinics are across the state. So we want to see more people coming out and getting vaccinated. We're now at 23.07% have had their second dose across Queensland of eligible Queenslanders. We're seeing that number going up every day now, which is fantastic. I do want to just go through again, as Dr. Young has, what restrictions are now in place for the ACT and also those 7 local government authorities across the border zone. So when it comes to the ACT, there are 3 groups that we need to talk to. First being anyone who is already in Queensland, who arrived before 5 p.m. yesterday, who has been in the ACT on or after the 9th of August. For those people, you must home quarantine immediately and remain in quarantine for 14 days since arriving in Queensland or since the 9th of August, whichever is shorter. The next group is anyone who arrived from 5 p.m. yesterday. You are all required to quarantine at home for 14 days. And the next group were those that arrive from 1 a.m. tomorrow, Saturday, the 14th of August. You will be required, if you are eligible to come into Queensland, so you have a border declaration that allows you to come, so you're a Queensland resident or you have an exemption to come into Queensland, you will have to go into hotel quarantine. So those are the 3 categories. In relation to the 7 local government authorities on the border, I just want to go through the essential workers. I know there's been a lot of discussion over the last 24 hours who can and can't come in and out of those 7 LGAs. So essential workers are medical practitioners, an emergency health services or emergency services worker, national defence, state security or police worker, a freight or logistics operator, an emergency infrastructure worker, emergency volunteer, disaster management worker, a critical infrastructure worker, a tradesperson or construction worker for essential or emergency construction or repairs only. Essential workers do not include teachers, anyone who can perform their work remotely at home, childcare workers, hospitality workers, sale representatives, and commercial construction workers on non-critical projects. Can I just emphasise, I know there's been a bit of discussion about teachers and childcare workers. because in the past they haven't necessarily been excluded from these movements. The reason why we have to exclude them in relation to these 7 LGAs, and it's only the 7 LGAs that New South Wales have put into lockdown, is because we cannot risk these teachers and childcare workers coming into Queensland, going into our schools and our daycare centres and risking spreading the virus. We've seen what this Indooroopilly cluster can do, and we've seen what having students infected can do. We are up to 137 people infected from our Indooroopilly cluster. So we can't take the risk of the virus getting into any of our schools. So we ask people to comply with those restrictions, and of course they're obliged by law to comply with the New South Wales lockdown restrictions anyway. Any other areas outside of those 7 LGAs that are in the border zone, the normal arrangements apply as far as travel and the border declarations. Last shout out, of course, is to our household home quarantine people who are still having to remain in quarantine. Thank you for the great work you're doing. I also want to give a shout out. I've been meeting lots of people, including at the convention centre the other day, who are supporting friends and family who are in home quarantine. And thank you for reaching out to them, for offering to walk their dogs, getting groceries for them. All the help you're doing means that these people can stay at home. So we're really grateful for that. And the last thing, I've been asked to give a bit of a call out. Our disposable masks, we're seeing a fair bit of littering of those disposable masks. So can we ask everyone to be responsible and dispose of your disposable mask in rubbish bins so they're not littered all over our streets and potentially going into our waterways as well. Thank you.
We've continued our enhanced focus on our road borders with New South Wales in the past 24 hours, and we've intercepted 6,381 vehicles during that period. 192 have been refused entry. No persons have had to go into quarantine, and only 2 breached the directions that required on-the-spot fines of $4,135 for each of those persons. So overall good compliance, but still a few too many people trying to get in that shouldn't. We're continuing to see an improvement in the masks, so thank you for the community for listening to the messaging, but it's still there. 65 masks handed out yesterday, and for the first time in quite some time, no infringement notice was issued in relation to masks. So let's keep that improvement going. Overall, enforcement was fairly low in the last 24 hours, so only 4 on-the-spot fines, 2 of which were for persons in home quarantine. So a reminder, a thank you first for everyone in home quarantine for doing a brilliant job, but we do check. So out of 775 checks of persons in home quarantine, yesterday we found 1 household where people had gone for a drive to get a break. Even though they hadn't done anything else, you still can't do that. So they were issued with on-the-spot fines in relation to that. And overall, our business compliance has been very good. So thank you to the businesses. 90 checked yesterday and no infringements. Thank you.
We'll have we take a few questions.
I realise this is a decision for New South Wales, but would you like to see all of New South Wales go into lockdown given we've seen those cases spread? Would that put your mind at ease?
I think New South Wales, very good question, Claire. Look, New South Wales needs to have a clear plan for containment. This is of serious concern to the rest of the nation. I'm very concerned about Queensland, which is why we've put in place those really strict restrictions of those LGAs, but we're seeing the virus creep north. It is a real concern. So what are the plans for containment?
You're talking about opening up bars for people who are vaccinated. Will you be suggesting that's not the way forward for New South Wales?
There's a national plan in place, and I would hope that New South Wales is part of that national plan. And that national plan is about 70 and 80% vaccination. But what we do have in New South Wales at the moment is a large outbreak. So I think we need to see as a nation the plans for that containment.
Do you think as statewide...
And can I say too, look, this is very difficult for the families in New South Wales as well, and our hearts go out to them. And we do wish them all the very best. But we are seeing this is a contagious variant. It's spreading, it spreads easily. I've seen what's happened in places like Japan. I've seen how airports have been completely almost shut down, large international airports. This virus, once it takes hold, it's hard to stop. So what are the plans for containment?
Do you think, though, a statewide lockdown would be much clearer in terms of containment then?
Well, I'm looking forward to hearing those plans today.
You would welcome that, though?
Sorry?
You would welcome a statewide lockdown?
Let's hear what they have to say first. But it's encroaching into regional parts of New South Wales. It's encroaching north. It's encroaching south. It's now in the ACT. This is really concerning.
In previous Queensland lockdowns, we saw play equipment chained up and beaches fenced off. Do you think New South Wales is being too lax with their lockdowns?
Look, it's a matter for New South Wales, but it's now spreading from. It's not just in Sydney now. It's encroaching into other parts of the state. That is a real concern. Okay. Now it's up near the border, near where we are. It's of real concern.
The federal government effectively ruling out, mandatory vaccinations this morning, doing the rounds on morning television. Should they reconsider that? Will you be raising that at National Cabinet?
Look, that is clearly an issue for the Morrison federal cabinet. When it comes to issues about mandatory vaccines, it is the federal government that should be sitting down with industry and unions. It is entirely a matter for them. I've heard some reports about being pushed out to the states. Let me say very clearly, the national vaccination program and whether or not they want to mandate certain sectors is a matter for the national government. They need to step up, and it's up for their national cabinet to make those decisions. It is not a matter for the states.
How much notice was given to teachers and schools in that border zone? Were some schools left in a lurch?
Look, my understanding is that those conversations are happening, but we had a look at the data and it's very limited. Very few teachers, very few childcare centres.
You said that the federal government needs to step up. Do you think they've been too slow in making a call on which workplaces should make it compulsory?
It's a matter for them. So if industry has concerns and the unions have concerns, get them in a room, sit down, talk about these issues. But it's up to their federal cabinet to make those decisions. You can't just push it out to the states. It's not our responsibility. It's a federal issue. So I think the ball's in the Prime Minister's court here, with all due respect.
Can you clarify what non-critical construction means? I mean, a lot of people were trying to go to work this morning, might have gotten stopped at the border.
Oh, we'll get the definitions out to you. Yeah. Okay. Any other questions?
Dr. Young.
Yep. Sure.
Good.
Thank you. Thanks, everyone.
Bit of talk on AstraZeneca uptake this morning, Dr. Young. So people in their 40s turning out to get that particular jab, but then we're also hearing from doctors, people in their 70s and 80s being a bit apprehensive. So that is obviously the opposite to the ATAGI advice you've been presenting. Your thoughts on those two situations?
Well, it is critical that anyone who is 60 years of age or older, if they haven't already had one dose of AstraZeneca, to immediately go and get a dose. I don't know when our next outbreak will happen. We will get another outbreak, so there is no time to delay. And if you've had one dose, it's critical you get the second dose. I went and got my second dose. It was just over that 8-week mark. So if it's been 8 weeks since your first dose, please go and get your second dose of AstraZeneca, no matter what age you are. Then if you're under 60, you need to work through what your risks are. And it's lovely to see those people who've done that. You need to work through your risk, and if you think that your risk is such that you would like to be vaccinated immediately and you can't access Pfizer, so you can go online, you can book at one of our mass vaccination centres. If you can't get a booking and you want to get vaccinated sooner, then immediately, as quite a few people have, go and talk to your GP, and your GP, after that conversation, can give you AstraZeneca. But that is a discussion you must have with your GP. And that is AstraZeneca you can have once you're 18 or older. Pfizer you can have from age 12 or older. So it's really important that everyone thinks through what their risks are and what they should do. So we've opened up our bookings now to anyone from that age 16 or older, and we've opened the registration and we're sending bookings through. But until we get more doses of Pfizer from the Commonwealth, we won't be able to vaccinate as many people as I'd like with Pfizer. But as soon as we get those doses, we're immediately making sure we vaccinate people.
I think Indooroopilly High School going back today, it is just for one day. Did you give any thought that perhaps it might have been safer just to give them a long weekend, or you're very content with them going back on a Friday? It's just obviously a time thing, but any thought given to that? Just if you-
14 days is 14 days and it works every way you count it. So people needed to be in quarantine for 14 days. That ends, they can go about their normal lives. So no, I never considered that to ask the school to do something different. Otherwise, we'll get ourselves all tied up in knots. 14 days is 14 days.
If there's more cases over the weekend at those schools, is it going to look like they're going to have to shut down again?
There will be more cases, but they'll be in people who are in quarantine. So we still have those families where there's been a positive case. And I know we will get more cases, but they're the families that are staying in quarantine. So the message is very, very clear. If you've had one case in your household, you then need to work through with the public health people who will be contacting you and have spoken to you when you can then be released. And every single time another person in a household becomes positive, it's unfortunate, but that count starts all over again. So yes, there are some families there who are going to do it exceptionally tough.
Do you think it would help if New South Wales went into a statewide lockdown?
These are the sorts of things we're discussing every single day at AHPPC. If there's anything we can do to assist New South Wales, so we're working nationally so that we provide them additional contact tracing support and we provide as much support as we can. So they're having those discussions in New South Wales and I'm sure they will do what is the best thing that they need to do for their population.
Would it help Queensland though? Would it help Queensland, particularly with the border?
Well, we've already declared all of New South Wales a hotspot, and so we have our border zone, which allows a little bit more movement, and where New South Wales is locked down within that border zone, we've tightened that. So we've got to remember, all of New South Wales today is a hotspot for Queensland, including the ACT.
Given the rate of the spread in New South Wales, how likely do you think it is that COVID will spread into Queensland?
We are going to get more outbreaks in Queensland. I can't say whether they'll come out of New South Wales or if they'll come out of our international border, if they'll come out of those cases that they've clearly got in the ACT. They could come from anywhere, from Victoria. So we will see more cases in our community. So we need to be prepared for that. And we need to do, I'd love to find out how Cairns has done it, we need to do whatever Cairns did because it's not spread up there. So we can manage this. It's really important. We just have to be less social with one another. This is not the time to hug people or to, give someone a kiss. It's time, except in your own household, of course. It's time to just try and maintain that bit of distance. Wear the masks, and you all know that as soon as I think there's a risk, I'll ask for masks. And when I think there isn't a risk, I'll say we don't need masks. But at the moment, we all need to wear masks.
Melbourne had that ring of steel around it last year. Do you think that's something that New South Wales should be considering?
So New South Wales is managing their lockdowns. They're making sure people understand them. And I know that people in their regional parts, I've got relatives down there, hear them and they follow them.
What portion of Queensland's aged care workers for Queensland Health have had at least one vaccine, and how do you prepare to plan for a work shortage once that September deadline approaches?
It's reasonably good, but I'll get the media team to send out that specific data. I don't have it with me at the moment. But yes, we will work through with our aged care that they are all vaccinated. That's critical. There's no excuse.
And any contingency plans on how to deal with the shortage once September comes around and they're no longer able to work?
Yeah, so it's one dose by September and we're on track for that. And then it's a second dose after that. And I know our hospital and health services have been working through those contingency plans.
Okay, thanks everyone. Have a nice day.